Good afternoon. Thank you so much for this opportunity that you've given to me. Thank you for almost successful conclusion of your conference. I am Dr. Maureen Frank. I'm discussing on effect of sensitization on attitude of female health workers towards cervical cancer screening. A study that was carried out in Bayelsa State. Cervical cancer screening is a type of cancer arising from the cervical, from the cervix. It is a leading cause of morbidity and mortality among women, and the second most common preventable and treatable form of cancer. Is my video showing?
Yes, we just looking at the first page, if that's what you are showing.
All right. Okay. Okay. Just a minute. Just a minute. Okay. So we're saying that the slides are showing now. Hello?
Yes, it is showing. Yes, we are on the background. Yep.
Thank you. So numerous health interventions such as cervical cancer screening, among other, it has been proven to be safe and effective to detect the precancerous lesions. And in developing countries like Nigeria, they are still experiencing pitfalls in achieving reduction in prevalence and mortality, thus accounting for the high mortality rates that Nigeria and these developing countries are experiencing. Cervical cancer screening is a procedure that is carried out by female health workers and all other workers, including female health workers. They are enlightened to, more than the public, and they know more about all these procedures. They are more knowledgeable, and their attitude will have a lot of impact on women, either to take up these and then take up this screening to save life, and either not to take it up. However, the knowledge they have has not been translated into the positive attitude towards cervical cancer screening and has remained a challenge over the years. Therefore, we engaged this study to assess the effect of sensitization on the attitude towards cervical cancer screening among female health workers. Actually, we used jingles, health education, health talks and workshops. These were some of what we use in their sensitization. Cervical cancer mostly affects young women aged 35 to 59 years, which poses a major threat to their health. It's a public health challenge. Also social and economic health. Healthcare professionals, on the other hand, they serve as important predictors to the utilization of screening services. And we've seen that most of them, they have displayed negative attitude, which should be implicated in the high incidence of cervical cancer. This also was corroborated by the findings of a study by Ndejo et al. In 2017. In Bayelsa State, it has remained fairly unchanged. The incidence for over a decade at a range of 1.5% to 1.25% during 2012 and 2021. This is a cause for concern to assess the effect of sensitization on the attitude of female health workers towards cervical cancer screening, which has been proven as a means of helping to identify this cancer at its earlier stage, which will also help in the treatment and give a good prognosis. We have said that the purpose of the study is to assess, their attitude, the attitude of female health workers towards cervical cancer screening, to enable them be able to find out the women at risk and also to attend to them. Then We have talked the objectives, specific objectives. We are to determine the effect of sensitization on the attitude and to determine the influence. We use female health workers in nursing, medicine, medical laboratory scientists, and then we use pharmacists and then radiographers. This want to determine if their profession also has some things to do with them participating in the, in their attitude towards the uptake of cervical cancer screening. We also formulated a hypothesis concerning that. Then we use female health workers from 2 different institutions, about 140. We use one group as a control and the other group as an intervention group. Like we said, we used some jingles, health talk, and these jingles, the frequency, the intensity was increased, as the weeks go by. We did a pre-test and we did a post-test after some weeks of the jingle, of the sensitization. And so we used a quasi-experimental design to carry out the study. Then we did the study in Bayelsa State. 2 different institutions were used. We said that the population of our study is the female health workers. Like we mentioned, they are nurses, medical doctors, medical laboratory sciences, and we used them as our population. The sample was taken, it is a definite population, so we used Taroyamen, and we used proportionally stratified sampling techniques to be able to get the sample size for each profession. Inclusion criteria, those that belong to the professions mentioned, and the willingness of the participants to be part of it. We use questionnaire to collect our data. The validity, content affairs validity of the instruments, we are also ascertained. We used retest methods to test the reliability, which was subjected to Sperman-Brown correlation coefficient statistics, which gave us a point that we used 0.75, which was considered adequate for the study, for the instrument. Our ethical consideration, we also received ethical approvals from the necessary quarters so that they can allow us, both the participants and the institutions. We collected data from the 2 different institutions, and data was collected in phases. We have 3 different phases. We have the pre-intervention, we have the post, we have the pre-intra and post-intervention. And those of control, we did not really give them any intervention. You know that female health workers have been, at the forefront of encouraging women on taking up these, health cares. The experiences we had in breastfeeding, exclusive breastfeeding, family planning has given us a lot of results that women actually, women actually heeded. They took the health talks, health education that were given them by female health workers, and we have witnessed a lot of improvement in, reduction in childhood killer diseases. These are the things that, female health workers contributing, participating, being committed to creating awareness and, teaching women, their fellow women. The women population, they are interested, they hear, they listen to their fellow women. And so it has helped. And unfortunately, cervical cancer has not received this kind of awareness and commitment from the female health worker. Our data was analyzed. We used descriptive statistics, and then we also use analysis of covariance in the presentation of data. Our results showed that the attitude of female health workers is poor. Now we did a post and pre-interventions. We carried out post and pre-intervention. At the pre-intervention stage, the control group and the intervention group almost had similar results at the pre-intervention stage. Even also, we tested their profession, if the profession has anything to do, has any influence on their attitude towards cervical cancer screening. So pre-intervention shows that there was not much, the difference is, there were no differences. Their attitude are the same, but post-intervention, we observed that there are some differences. In post-intervention, we saw that there is a attitudinal change. If you look at the attitude pre-intervention amongst the control group, they have a negative result, which was about minus 0.7, while the post-intervention for the intervention group, they had a positive impact. Their attitude, there was a positive attitudinal change towards cervical cancer screening. And the implication is that intervention is necessary to enable them, to help them. That is what we saw in our discussion. We saw that at pre-intervention, participants' attitude towards cervical cancer screening, both in the control, that is in control, we had 2.53 standard deviation, 0.25, and intervention groups, 2.47 and SD 0.23, we are almost the same, indicating that both groups had negative attitude towards cervical cancer screening. Also, at post-intervention, control group had an attitude mean rating of 2.47 and SD 0.32, while intervention group had an attitude mean rating of 2.85 and SD of 0.35, indicating that a mean attitude change of minus 0.07 and SD of 0.47 for control group, while intervention group had a mean attitudinal change of 0.31, SD 0.53. Hence, there was attitudinal change between the two groups, and this attitudinal change can be, can be as a result. It is as a result of the intervention, because we have seen the difference between the control group that did not receive any intervention and the intervention group that received intervention. So there is an attitudinal change that occurred as a result of the intervention. And then influence of profession. There was no mean attitudinal change values of each profession. Reads us, nursing we have 0.23, 0.55, medicine 0.53, standard deviation 0.50, pharmacy 0.21, SD 0.70, med lab science 0.33, SD 0.46, and radiography 0.23, and SD 0.20. This indicates that variation in mean attitudinal change among each profession is almost the same. It didn't have any influence profession, they are all the same. Therefore, the study revealed there is a significant relationship between sensitization and attitude. In the hypothesis that we stated, there was no significant relationship. But from this study, we have found that there's a relationship between sensitization and attitude towards cervical cancer screening among female health workers. And the values are there. So the null hypothesis was rejected, at the level of 0.05 level, significant. So we see that intervention had effect. What is the implication of this? To health workers, nurses, medical doctors, the implication is that similar, simple, sustainable, and effective intervention should be developed and reinforced at intervals to boost and improve nurses' attitude towards cervical cancer screening. Not just nurses, but the healthcare workers, especially the females among them. Also, the findings has also provided evidence-based information that will guide the healthcare providers, especially the female healthcare providers, in reaching out to the large, looking at training institutions and environments. They should also incorporate cervical cancer screening skills, because some of the factors we actually made inquiry with, and some of the factors, some of them also that they don't have the skills. No, they were thinking that cervical cancer screening is just meant for only those that are in the gynecological unit. But ideally, it is supposed to be for everyone. So maybe the reason could be because there is no screen, they don't have the skills. So the screening skills should be embedded in the curriculum to enable the healthcare workers to acquire the skills for attitudinal change, as well as increase uptake and be actively involved in cervical cancer screening. This study is limited because it just assessed just the short-term effect of sensitization in one instance for an intervention group. In conclusion, we concluded that majority of study participants, majority were nurses, and at pre-test female health workers had negative attitude towards cervical cancer screening, and that participants' profession had no significant influence in their attitude towards cervical cancer screening. At post-test, participants, that's the control group, attitude towards cervical cancer screening decreased to 0.07, while the intervention group improved with a mean attitudinal change of 0.31 and SZ of 0.47. There is a significant relationship between sensitization and attitude towards cervical cancer screening among the study participants. And then we recommend that there is need for an intensive and extensive sensitization of female health workers about the necessity of their active involvement in cervical cancer screening and its activities. This is our take-home message. This is what the healthcare workers, maybe, I don't know how many of us that are there with this message. How many of you are screened? Are you working together? Training curricula of health workers needs to be revised to improve cervical cancer screening and its screening skills acquisition. There should be national cervical cytology in our nation. There should be national and institutional policies, such as making cervical cancer screening part of its routine check for eligible women. These are the references that we used. Thank you for listening.